Good day, everyone. So, for this day, we will be talking about drugs, which is the chapter 4 of our module. So, the definition of drug is it is a chemical substance, meaning this is a product of laboratory procedure that brings about physical. When I say physical, so may effect siya sa katawan ng tao. Physiological is to the extent na tissue and cells nung body natin is affected. Behavioral or psychological is our mental state. So may epekto siya sa mental state of a person who is taking it. So remember children that all medicines are drugs. So lahat ng medicines are drugs, pero hindi lahat ng drugs are considered as. So we have several um, differences between medicinal and dangerous drugs. So pag medicinal, so this is taken to cure something. Example is may sipon kayo or ubo or lagnat, you need to take medicinal drugs for you to relieve that kind of disease or a symptoms of disease. So when we say symptoms, konti pa lang yung nararamdaman mo, you consume a drug to prevent it from getting a disease or becoming a disease. When we say dangerous drugs, these are the drugs that affects the central nervous system, so the state of mental functioning of a person. So it alters physical, emotional, or behavioral changes, or it alters the physical, emotional, or behavioral outlook of a person. So when we say drug abuse, ano siya? Abuse siya in taking drugs. So, non-medical drugs ito that causes physical, psychological, legal. When we say legal, meron siyang hindi na follow ng batas kasi the prohibited drugs are being consumed or being abused by a person. So, economic, affected yung economic condition of the family, and social damage because the user's behavior is literally or totally altered when they are having drug abuse. So remember, abuse happens because of illegal drug consumption. But sometimes, legal medication or medicinal drugs are also being abused. And then, especially those that are over-the-counter medications such as mefenamic, paracetamol, antibiotic. So, drug abuse din yun. Pero, hindi siya illegal. So, nagkaroon lang ng problema during the consumption of medicinal drugs. So, as to the classification of drugs, there are two. The first one is natural, meaning coming from natural organisms such as plants or animals. So, example of these are raw opium, marijuana, or coca bush. And then synthetic drugs naman are artificially produced, meaning develop ito in the laboratory. So, ang intention of developing synthetic drug is primarily for medicine. But sometimes, due to some who are consuming synthetic drugs, they are sold in illicit market and then and of course developed by illicit laboratories kasi this kind of drugs are prohibited or not allowed by our law. So example is methamphetamine and barbiturates. We have also different legal classification. Si RA 9165, meron siyang different classification or the Comprehensive Dangerous Drug Act of 2002. For the PD or Presidential Decree 1619 on the consumption of volatile substances and RA 6425 for the regulated and prohibited drugs classification. So later on, we will be talking about these three legal classifications. So for 9165 or the Comprehensive Dangerous Act of 2002, according to this, yung term na prohibited and regulated ay due to the three or limited to the three classification. So first is immediate precursor, meaning to say those that are manufacturing these illegal drugs or incorporating these illegal drugs in a part or in a whole in something is considered as immediate precursor. Halimbawa, nag-develop kayo ng cookie and then nilagyan nyo ng marijuana, so that is immediate precursor. Essential chemicals naman are those who are involved in the production of or manufacturing of certain chemical substances that is intended for reagent, meaning gagamitin siya para mabuo yung isang drugs. And narcotic, psychotropic, and designer drugs as well. So, according to international classification, we have three: narcotic, psychotropic, and designer drugs. For pharmacological classification, meron tayong stimulant, hallucinogen, depressants, and inhalant. This will be discussed further in the following slides. So this is an example. First is stimulants. So you can see that in the picture that is the amphetamine. So ang stimulants are drugs which increase alertness of physical disposition. Okay? So ang amphetamine po ay usually tawag dito is eye opener, lead popper, pills, upper, or hearts. So ano siya, mulat na mulat yung tao or very active yung kanyang senses. So this reduces appetite, so hindi sila makakain, relieve mental depression, and then comfort, fatigue, and sleepiness. Remember, we have to point out that it relieves mental depression. Those people who are going into amphetamine sometimes are due to the reason that they are mentally depressed and they need comfort and they need comfort. That is why they consume this one. So may kita ninyo that this one is consumed orally in tablet or capsule. So iniinom siya. Ang effect nito is hindi ka makakatulog pero very alert ka. However, kapag na-consume mo siya in a very very high amount or nagdire-diretso ka ng consumption of this, pwede kang magkaroon ng restlessness, tokama, and death. Since hindi ka kumakain, pwede kang magkaroon ng problema sa health mo and eventually you will be comatose and death later on. Ang danger po neto is dependence. So meaning addicted ka na. Overdosage, so that will result to death. Violent, bizarre behavior as well. Next one is another type of stimulant is Shabu, or also known as methamphetamine hydrochloride. This is the chemical name of Shabu. So this one is called as poor man's cocaine, S, shabs, ubas, siopaw, sha, and ice. So odorless ito. Wala siyang amoy. Pero yung chemicals in developing this is maamoy. Crystalline powder, meaning para siyang tawas with a bitter numbing taste. So, ang pagkakaiba niya sa tawas is kapag nilagay mo yung tawas dito sa bibig mo, pag tina-taste natin, kung halimbawa may parang kamukha siya ng tawas. So, titingnan mo at lalasahan siya kunyari. So, yung tawas is mapakla. But for this one is medyo nangingimay yung part na tinamaan na to. So, usually, this is taken through ingestion. Kino-consume siya using iniinom or inhalation, meaning sniff natin yung kanyang vapor. Some other people naman, yung sobrang taas na ng kanilang needs is ini-inject and ini-smoke. So, ang effect neto is anxiety, irritability, irrational behavior. So, yun yung minor. Pero in the long run, pwede kang mabaliw because of this. That is the psychosis. And similar to such, schizophrenia, nakakakita ka na ng iba't ibang images that are altered or not real. And difficulty in concentrating, loss of interest in sex. However, the physical part of this or physical effect of this is chest pain. Kasi, affected na si heart mo. Irregular heartbeat, hypertension, convulsion, or death. Kailan nagiging death? Kapag hindi ka na nagko-consume and then affected na si central nervous system. Ang danger po netong associated for the consumption of shabu is the injection from contaminated needle. So, nagpapasa-pasa ng needle. One, drug dependent is, or drug abuse is, meron siyang HIV, AIDS, hepatitis B, C, ganun. So, pwede siyang mapasa sa iba. Okay. Next. So, we have several um, differences between medicinal and dangerous drugs. So, pag medicinal, so this is taken to cure something. Example is may sipon kayo or ubo or lagnat, you need to take medicinal drugs for you to relieve that kind of disease or a symptoms of disease. So when we say symptoms, konti pa lang yung nararamdaman mo, you consume a drug to prevent it from getting a disease or becoming a disease. When we say dangerous drugs, these are the drugs that affects the central nervous system, so the state of mental functioning of a person. So it alters physical, emotional, or behavioral changes, or it alters the physical, emotional, or behavioral outlook of a person. So when we say drug abuse, ano siya? Abuse siya in taking drugs. So next is another type of hallucinogen is the LSD or lysergic acid diethylamide. So ang tawag dito sa street ay Lucy. So para siyang may iba pa siyang term like diamond wedding bells, acid, white sugar, lightning cubes, brain eaters. Why do we have to include names or street names? Because these are the actual names in the street being used by the peddler and then the consumer. So, LSD ang hinahanap mo pero iba pala yung term nila sa streets. Okay? So, what it is, this is a semi-synthetic alkaloid. So, galing pa ito sa fungi. And then, yung fungi na yun is galing siya sa wheat, sa harina, and other grains, odorless, tasteless, and colorless. Ang effect nito is more on hallucination. So, meaning, yung nagko-consume nito is nakakita ng kung ano-ano, confusion, blurring, and distinction between consciousness and unconscious thought. Okay, so hindi na nila nakikita yung differences. Ang physical nito is dilated pupils, meaning maliit yung kanyang pupils, flushed face, maputla, and increased blood pressure. And then ang danger can resulted to abnormal amount of chromosomes, like in the white blood cells uh, that may bring anemia or leukemia to the next generation. And those who are using LSD na buntis can have miscarriage. Kung nakalusot, can have birth defect for their baby. Okay, this is another example of hallucinogen or commonly named as marijuana. So this is the most common drugs being sold in the Philippines aside from Shabu. Okay, these are the pictures of marijuana. So ayan yung mga street name: Mary Jane, Flower, Pampapogi, Brown Hines, Damo, Pot, Tea, Joint, Dope. Okay, so it came from Cannabis sativa L or Indian hemp. So garo siya tabako na kinokonsume siya as tabako or sigarilyo. So they are smoked in pipe, cigarette. Sometimes these are taken as food. So sometimes it is incorporated into candy, sniff into powder, and mixed with honey or butter. Or sometimes naman they are getting the cannabis oil or oil nito and the ones being used for inhalation. Ang epekto nito is for immediately after you consume this, faster heartbeat, bloodshot eyes, dry mouth. So bloodshot eyes meaning mapula yung mata. Dry mouth is yung nagbabakbak yung bibig. Long term, chest pain. Bakit chest pain? Kasi mabilis yung kanyang heartbeat. Temporary loss of fertility, may pagkabaog. cancer, marijuana, burnout. Saan usually yung cancer? Lung cancer to. Ang danger neto is in the long run, it affects or alters the mental and psychological activities of a person. So, kapag matagal kang gumamit, pwedeng mabaliw ka. And then, psychological dependence, meaning maya-maya mo siyang hanapin. And in some cases, this may lead to death due to cancer. Next is our why when we consider drugs as a dangerous drugs. According to Republic Act 6425, pwede siyang i-consider yung drugs as prohibited, regulated, and volatile. Pero i-consider siya as dangerous drugs when it affects the central nervous system. Kapag apektado si physical, si emotional, or behavioral ng tao. Kapag nabago yun ng drugs, that is considered as dangerous. And kung pabago-bago na yung mood ng tao, yung perception iba na. Okay? So, halimbawa, nakapatay siya pero masaya pa siya. So, that is a different effect of a drug and feelings and a behavior. Kaya natatandaan natin siguro na yung mga cases ng rape na matanda yung ni-rape, babo yung ni-rape, aso yung ni-rape. It's because those persons involved in that cases are using drugs. Okay? So another one is prohibited drugs. These are not allowed by law. Example is the opium and its derivatives, heroin, morphine, coca leaf and its derivatives, cocaine, alpha and beta-eucaine, hallucinogenic, marijuana, and then ayon, psychological effect of narcotic or hallucinogenic. So this is amended in 92. Pag regulated naman, allowed siya ng batas pero in some extent. So these are the list of regulated drugs. 165. And ang characteristic ng drug dependency is you are considered as physically dependent, kailangan mo siya. Kasi nagbabago yung system mo, yung physical system mo. Pag mental, ito naman is may need ka that needs to be satisfied. Hindi ka okay hanggat wala yon. And idiosyncrasy or side effect. Okay, and those who are using this, so ginagamit siya either in injecting, intravenously, so tinuturok siya sa muscles, pwede din kinakain, smoke, sniffing, eating, swallowing, drinking, gaya ng alcohol, or otherwise, inilalagay natin sa system. Pag sell naman, ito yung pagbebenta. Both are considered as illegal, using and selling. So that is why if you are using or selling drugs, particularly the prohibited drugs, you are sanctioned by the law.